In today's Daily Health, we're talking about iron deficiency and really how it impacts our bodies, especially for women.
According to the medical journal The Lancet, roughly 35% of U.S. women under the age of 50, 35% are iron deficient. It can put your immune system in serious jeopardy. It can even cause cognitive and behavioral issues. Joining us now, Dr. Curry-Winchell. Thanks for being with us. How does somebody know if they're iron deficient in the first place, and what is considered normal or abnormal?
So there's a wide variety of symptoms. You have to think about headaches, fatigue. Also, just not being able to sleep at night can be one of the common symptoms, as well as brittle nails and hair loss. And what we have to look at is when it comes to testing, as you mentioned with women, we are seeing a disproportionate rate of diagnoses that are going missed. And so this is an important topic to talk about.
It is really important to talk about. And when we look at sort of just iron deficiency as a whole, something that a lot of women don't even realize they have, what is actually the cause of it, and why are so many women specifically impacted?
So there's a wide variety of causes, but when we talk about women specifically, we have to look at menstruation cycles. So that, we lose a certain amount of blood every month, as well as pregnancy, and our diets can be a part of it. But one piece that is often not discussed, we know studies have shown that women are often dismissed when we come into the clinic and share some of the symptoms that are associated with being anemic or deficient in iron. So that's another piece that's a part of the story.
And doctor, how does low iron impact our overall physical health or even mental health?
So iron is so important in respect to it carries oxygen throughout our body. And so we need it to really be able to concentrate for our brain, our lungs to breathe. And so when we don't have enough, that's when we start to have difficulty concentrating. We're not able to exercise as much. And so to your point, when you don't have the amount of oxygen that you need to go through your daily activities, it can be difficult just to have that mental, acumen and all the things that you want to do to get through the day.
Speaking of which, what are some of the things we can do to get through the day, especially for those women who are affected by those unusually low iron levels? How can we boost our iron even naturally?
So I always share with my patients, eating iron is so important, and we are able to actually have a wide variety available. So such as meats and vegetables, green leafy vegetables. Now, if you are a vegetarian, there's so many different options such as tofu and beans. Now, if you're not able to get it through your diet, there's also supplements. But I always really like to highlight we have to be careful because sometimes getting too much can also lead to issues as well.
So you don't want to overdo it too much or take too many supplements.
Right, exactly. All right. Dr. Curry-Winchell, thank you so much for joining us. We really appreciate your time and your expertise.
Yeah, it's really interesting and informative. Appreciate it. You're watching NBC News Daily.